The reason this is not a formal hearing of the subcommittee on primary care and aging is that it takes us through our rules some 2 weeks to notice it. And I wanted to move this hearing faster because of a lot of the discussion that is out there. As I think everybody knows, ostensibly our government is shut down right now because there are people who are insistent that we defund Obamacare, the Affordable Care Act, or we delay it for a year. And because of that insistence, some 2 million people are not on their jobs. People are not getting hurt. Federal employees are getting hurt. And tens of millions of Americans are not getting the services that they desperately need in all areas of our life. And that is because people believe we should repeal and end Obamacare. And the point of this hearing is to ask a very simple question. How many people will die if the Affordable Care Act is repealed? How many people will die and suffer if 20 million Americans who will receive health insurance of one kind or another under the Affordable Care Act do not receive that insurance? Today, there are 48 million Americans who have no health insurance, 48 million. Today, we are the only country in the industrialized world that doesn't guarantee health care to people as a right. Today, we are spending, despite all of those horrible statistics, almost twice as much per capita on health care as any other nation. And when we talk about 48 million people not having any health insurance, that only tells half the story. Because there are tens of millions of other people who do have health insurance, but they have large deductibles and they have large copayments. And when they get sick, when they are in pain, they say, can I afford to go to the doctor? And many of them end up saying, no, I can't afford to go to the doctor. It will get better. I'll go next week. I'll go next month. And I have talked to physicians throughout the state of Vermont who have told me time and time again that they have treated patients who have walked in the door and they have said to those patients, you are really ill now. Why didn't you come in here 6 months ago when you first detected your illness? And people say, I didn't have any insurance. I don't want charity. I just felt awkward about coming in to your office. And some of those people died. So the question that we are asking now is what happens when many, many, many millions of people do not go to the doctor when they need to go to the doctor? And how many of those people will die? Now, nobody can come up with an exact figure. No one can. But there was a study that came out some years ago at Harvard University, estimated that some 45,000 people die because they don't have insurance, because they don't get to a doctor when they should. I know Families USA did a different type of study. But whatever the number may be, it is absolutely clear and indisputable that if we deny the health insurance that 20 million Americans will get under the Affordable Care Act, we don't know the exact number, but at the very least, thousands and thousands of our fellow Americans will die because they will not get to the doctor when they should. And that's the very simple message. So for all of those folks who are saying we have to repeal the Affordable Care Act, what they are doing is passing a death sentence on many of our fellow Americans. And that is a tragedy, and that is unacceptable. This morning, we have an excellent panel of people who are very experienced in the whole issue of primary care. And we're really delighted that they're with us because, again, this is an issue that does not get the attention that it deserves. And of all of the problems that our current dysfunctional healthcare system has, I would put at the very top of the list the very poor job we're doing in terms of primary care and making sure that every American can get to a doctor when he or she needs to. I know that Senator Angus King is going to be here in a moment. He has a busy schedule, and I'm going to put him up as soon as he comes here because he himself, as a senator, has a very interesting story to tell about what happened to him when he was a young man. But let's get going with this panel, and let me begin with Ron Pollack, who is the executive director of Families USA, and this is an organization that has been doing an excellent, excellent job for many years in the fight for universal health care. Ron?
Just one quick footnote about something you said. You talked about 48 million people who are uninsured, and of course that comes from the Census Bureau numbers that just were issued. But what the Census Bureau tells us is how many people were uninsured at a specific point in time. Now, 48 million is a huge number to begin with. It's more than the combined population of 24 states plus the District of Columbia, combined population. But the reason I thought I should mention it is it does not reflect how many people are uninsured at some point over the course of a year.
Good point.
And it's considerably larger than that 48 million figure. What we tried to do at Families USA, we tried to assess the approximate number of people who die due to the lack of health insurance. And the starting point for our analysis was a report issued by the Institute of Medicine in the year 2002. It was a publication called Care Without Coverage, Too Little, Too Late. And it was designed to tell us, based on the best science that they could muster, how many people between the ages of 25 and 64 died due to a lack of health insurance in the year 2000. And so what we did was we then updated and applied the exact same methodology that the IOM had used, and figured the IOM is probably as good a scientific, nonpartisan body as you can find. And here, so we did an analysis for the year 2010, one decade later. And we found that in the year 2010, approximately 26,100 people between the ages of 25 and 64 died prematurely due to a lack of health coverage in that year. Now what does that mean? Typically, people who are uninsured defer care. The onset of a pain, the onset of an illness, they don't go to a doctor because they don't feel they can afford to pay for the doctor. And as a result, they wind up ultimately in an emergency room, but sometimes the disease has spread, and something that could have been dealt with at an earlier time did not get dealt with adequately. Now, what does that mean in terms of intervals of time? If you apply the 26,100 people who, again, using the IOM methodology, who died in 2010 due to a lack of health coverage, that means 2,175 people died each month on average. 502 people died prematurely each week, and 72 people died prematurely each day. Another way of saying it is every 3 hours, a person passes away due to a lack of health insurance. We calculated how many people died due to a lack of health insurance. In the years 2005 through 2010, the number of people who died due to a lack of health insurance, based on the Institute of Medicine's methodology, was over 134,000 people. And we broke it down by state. The only state we did not, or unable to do in that period of 2005 to 2010 was Massachusetts, which was undergoing major changes in the health system. The almost good news is Vermont had the lowest number, but still, for Vermont, it was 154 people who passed away in that period. The state with the highest number was California, over 16,000. Second highest was Texas with over 15,000 people. I should say to you that's consistent with the way you opened this hearing, is there have been other analyses about the number of people who died, and the number you provided, about 45,000, that's from the American Journal of Public Health, but we decided to use the conservative, supposedly scientific best evidence of how many people died that the Institute of Medicine developed. So I see my time is up. Thank you for giving me this opportunity.
And we'll continue that discussion in a minute. I invited Senator King here, not just because he's an excellent senator who's concerned about the issue, but because he has a personal story to tell. I mean, one of the things that we've been hearing lately for those people who want to terminate the Affordable Care Act is young people are healthy. Doesn't matter if young people don't have health insurance. I think Senator King has a story to tell about that. Senator King, thanks so much for being with us.
Thank you, Senator. I'm delighted to be with you. This is a very important hearing and an important topic, and I think one that hasn't received sufficient attention. This discussion is particularly important to me because of an experience that I had almost exactly 40 years ago. I was 29 years old. I was married. I had 2 small children under the age of 4, and had good health coverage. And part of the health coverage that I had had a provision of free checkup every year. And I think that's and basically because it was a free checkup and because the health plan that I was in had Wednesday night hours, I still remember Wednesday night hours, where you could go in without taking a day off of work and without having to write a check and get a checkup. And I hadn't had a checkup, I think, at that point in something like 10 or 11 years. And this was the first year I had this coverage, so I said, well, to get the checkup. I went in, had the checkup, the doctor looked me over and noticed a mole on my back. And he said, I don't like the looks of that. I think we should remove it. I didn't give it much thought. He removed it, took 5 minutes, and went back in the next week to have the stitches out. And the doctor said, I think you better sit down. We biopsied the mole, and you have a disease called malignant melanoma, which at that time I didn't really know what it meant. I thought it was a skin cancer, not a big deal. I learned subsequently that it's a very deadly form of cancer. I had surgery. The surgery was successful. Basically, I've got a big chunk out of my back and up under my arms to take, one of my arms to take out lymph nodes. There was no sign of spread, so I didn't have to have radiation or chemotherapy. And here I am 39 years later. There isn't the slightest doubt in my mind that had I not had that coverage and had the preventive care without a copay, I would not be here today. The thing about melanoma is it is one of the most dangerous form of cancers, but it's also one of the most treatable. And it's a very simple analysis. You catch it in time and you live, and you don't catch it in time and you die. And I've had a number of friends who have died of it. So, you know, we talk about this issue of health care and health insurance and argue about the economics and jobs and all those kinds of things. But to me, I've had a hard time throughout my life wrestling with the reality of why me. Because somewhere else in America that year, there was another young man, I'm sure, with my general description and age and situation, who didn't have health insurance, who didn't go in for a checkup, who had eventually a lump in his neck or something like that, finally went in, found out he had melanoma. It was too late. He probably had surgery and chemotherapy. It didn't matter. It cost a lot of money, and he died. And so this has, I keep, you know, every now and then I ask myself, you know, how did I deserve this? And the answer is it was pure luck that I had insurance. And if I hadn't, I wouldn't be sitting here. And the figures that you were just cited, one of the problems, Mr. Chairman, I think with this situation is that these deaths appear, they occur invisibly. They occur one at a time all over the place, and it doesn't say in the obituary died because of lack of health care. It says died of some cancer or some other cardiovascular or something. But the reality is it was because of health care. And I've often thought that if it happened all in one town at one time, we would be moving heaven and earth to solve this problem. If we lost anywhere from what the estimates run from 26,000 a year to 45,000 a year, in Maine anyway, that's a significant town. And if we lost the town of Augusta in 1 year, everybody died, and then next year it was someplace in Colorado or Vermont, this society would have dealt with this many, many years ago. And finally, Mr. Chairman, it puts to me a moral face on this issue that none of us, I don't think, would stand by and watch somebody die in front of us. We'd call a doctor, we'd call 911, we'd try to administer CPR, we'd do something. But in effect, as a society, we are watching people die in front of us and not doing anything. And we're the only industrialized country in the world that has basically said, yes, we're going to allow this to happen. And that's the reason and I understand, I think as you and I both share reservations about the Affordable Care Act, and it's not perfect, it needs a lot of adjustment, and starting with their website. But the fundamental premise of providing more insurance coverage to more people is literally going to save lives. And because of the experience that I had, I cannot walk away from this issue because, as I said at the beginning, I have to explain to myself why I was fortunate enough and that other guy, wherever he was, wasn't. So I think this is a very important issue, and I think it's one that's often lost in the discussion, that we're talking about people's lives here, and not on a scale of 1 or 2, but on a scale of tens of thousands each year. So thank you for the opportunity.
Well, Senator, thank you for that. What can I say? I think you've said it all. It was moving testimony, and you're exactly right. I will pick up on a point that you made. I remember maybe 10 years ago, I was in northern Vermont, and speaking to a physician there, and he said, Bernie, let me tell you something. It was an obituary, I think it was the Newport News up in, Newport Daily News up in Newport, Vermont. And he said, the obituary said that Mr. X, who had some kids, young man, who was a logger, died from heart disease. That's wrong. He didn't die from heart disease. He died from lack of health insurance. Your point exactly. That it is an invisible plague out there because people do die of something, right. But ultimately the reason they died is they didn't get the treatment that they needed when they needed it.
Well, I was talking with a friend about this, and he said, but everybody gets care. You know, you can go to the hospital and go to the emergency room, but in the situation that I had, there wasn't anything that would have taken me to the emergency room. I wouldn't have done it probably. I wouldn't have wanted to incur the expense. I mean, the fact is that we're all busy. We all have our lives. We're all worrying about where our next rent check is going to come from. And so it's one of the last things that we attend to. And to say that, you know, people can get care, I think it misses I call it the time value of life, you know, about the time value of money. Timing is important, particularly in the disease of cancer. And 6 months or a year can make all the difference. In my case, I suspect it was a matter of 6 months or a year, given what I know. 9,000 people, by the way, die of melanoma every year in the U.S. And I've known people that have had it and they're just fine as I am, but I've also had some close friends die of it. And so the timing is important. And the reality is that if we don't have coverage, and particularly I think the preventive coverage, without a copay, I believe in copays. I think we should be responsible, but not in this one area. There should not be a barrier to somebody going in and getting a checkup.
And what I would add, I mean, what we are talking about most importantly is human life and the number of people who unnecessarily die. But let me throw into the equation the issue of money, and you made that point as well. So what ends up happening, rather than being able to treat somebody in the initial stage of an illness, what happened is that illness gets worse, they're hospitalized, we spend huge sums of money, and sometimes they still die.
Oh yeah, my treatment was infinitely cheaper than if I had to go in and then have a course of radiation and chemotherapy, which would have been the case had the disease been caught a year later and probably wouldn't have been successful. So, yeah, I mean, the early treatment is not only more effective and efficacious, it's cheaper. So,
Senator Cardin has joined us, and Senator, you missed some really wonderful testimony already from Ron Pollack and Senator King. But I wanted, if you wanted to jump in and
Well, Senator Sanders, thank you very much. I not only missed this testimony, I was subjected to Secretary Lew telling us the consequences of not increasing our debt limit. So
that's a near-death experience in
it
itself.
is. I mean, it really is frightening as to how we're putting our country at risk. And I thank Senator Sanders for bringing us all together, because this is life and death, the funding of health care. I know that personally, and Senator King, I appreciate your being here to talk about your experiences. So I know that personally in my state of Maryland, because we lost a 12-year-old, DeMonte Driver, from untreated tooth issues. In 2007, he had serious problems with pain in his mouth and couldn't get to see a dentist. He had no insurance. His mom tried. Talked to social workers, made numerous phone calls, couldn't find anyone to treat him. As a result, his tooth became abscessed, it became infected, went into his brain. He was rushed to the hospital, had a couple surgeries, cost $250,000, where, by the way, $80 of dental care would have prevented the $250,000 of health care expenses, and DeMonte Driver lost his life. Now, we've taken steps to change that. In the Affordable Care Act, pediatric dental is now an essential benefit. So we've taken, and we've also provided a CHIP program. So we have taken steps to make sure this doesn't happen again. But if we don't fund these programs, if we don't fund the health centers, because now we're providing a lot of that care, thanks to Senator Sanders' efforts to expand funding for the qualified health centers, we now have dental facilities in our clinics. So that we also, by the way, have website pages that tell us where dentists are available to treat all of our children. My point is this: if you don't fund it, it is life or death. It truly is life or death. And you go through the preventive health care issues, you're absolutely right. A lot of diseases are preventable. Colon cancer can be prevented. But you have to have access to these services, and that's what we've been doing here. If you don't fund it, it's not just funding the coverage, it's funding the access to the care itself. And that's where Senator Sanders has been such a strong leader. And I really do applaud your entire panel, because you've made that point over and over and over again. We're on a path to try to provide, in the wealthiest nation in the world, a nation that has the greatest health care facilities in the world. I represent the state that has Johns Hopkins and University of Maryland Medical Center, the best in the world. And so many people in our country still don't have access to that care. So we're on a path to try to improve. The one thing we don't want to do is go back. And that's what we're confronting today. With those who want to defund Obamacare, those who want to say that we can't afford to do things, it is taking this nation in the wrong path. And we've got to continue on the path that we have started down to provide universal access to affordable quality health care.
Senator Sanders, I'm afraid I must excuse myself to return to a hearing, but I, again, thank you very much for convening this panel.
Well, Senator, thank you very much, not only for your broad observations, which are right on, but for your sharing your personal experience with us. Thanks so much.
Thank you. Thank you.
We're now going to hear from Ethan Rome, who is the Executive Director of the National Healthcare Coalition, Healthcare for America Now. Mr. Rome, thanks so much for being with us.
Thank you very much, Senator, and thank you, Senator Cardin, for joining us. It's an extraordinary thing that you have brought this hearing, this panel together so that we can address this issue. But for me, what's extraordinary is that it's a national disgrace that you have had to. It just fundamentally is in this country. And the obstacle to ending this humanity has never been policy. It's never been resources. It's been political will. And today, this shutdown demonstrates that more than anything.
Mr. Rum, is your mic on, or is my?
sorry, sir.
Okay, good.
So, I will just say what I said briefly before. I want to thank you for holding this hearing, and I want to say that I think it is a national disgrace that you've needed to, particularly at this moment. The obstacle to ending this humanity has never been policy, it's never been resources, it's been political will. And right now, we're having a political struggle. And it puts these people at risk. And folks aren't talking about that. Folks aren't framing that. It's as if there is some partisan political struggle over legitimate issues. And there is nothing legitimate about doing nothing when we know that 45,000 lives are at risk. So we did a tremendous thing, and that's why the Affordable Care Act is such a triumph. Whatever its problems are and whatever the improvements are that are necessary, it addresses many of these issues. And so now we find ourselves with a war against seniors, against children, small businesses, poor, working middle-class families, and the uninsured. And as it relates to this issue, it's a war against primary care, a war against health disparities, a war against community health centers. Right? We're not just talking about financial barriers, we're talking about access to care. Now, as a society, we have taken action to reduce preventable deaths. And the examples, Senator Cardin, Senator King, the examples that we have heard are not people that have died because of natural causes. They died because of politics, because of financial barriers, because we have not placed a priority on doing something, on giving them access to health care. Now, as a society, we take action to address preventable deaths. Look at motor vehicle fatalities, reduced by half over the last several years. We have drunk driving programs in schools, aggressive laws, public service announcements. And so that is why it is so galling and so unconscionable that we have people who are obsessed with defunding, delaying, undermining, repealing, or otherwise destroying the Affordable Care Act. We finally made health care coverage available to the vast number of people in this country. And we're now having a discussion about how opponents want to take it away. This makes no sense, not just because the House passed it, the Senate passed it, the Supreme Court upheld it. It's just that it's the right thing to do. And trying to appeal it 40-something odd times and now holding the government hostage, talking about bringing global crisis. It makes no sense. So, and as you said, Senator, we are dealing with a very simple, stark fact. If the Republicans were to successfully repeal or defund the Affordable Care Act, they would effectively sentence 45,000 Americans a year to die prematurely for lack of health insurance in the wealthiest country with the best medical care on earth. So, and this is beneath us as a nation. It shocks the conscience that we have to deal with this issue at all. And so too are the abusive practices of the insurance industry, because they relate to this. 129 million Americans with chronic conditions like diabetes, high blood pressure, asthma, and cancer are at risk of not having insurance. And that means more people, the middle class, being at risk. And that's just wrong. And we should not be allowing that to happen. Thank you very much.
Thank you very much. Dr. Stephen Woolf is the director of the Virginia Commonwealth University Center on Society and Health. Dr. Woolf.
Thank you, Senator. Senator Cardin, thank you. I really appreciate this opportunity to discuss the importance of health reform. As an expert on this topic, I am mystified when I hear critics of health reform imply that we are better off without the Affordable Care Act. Better off, perhaps in some ways, but not in terms of our health, which should matter the most. Health has improved in the United States over the years, as it has in all industrialized countries, but not at the pace achieved by other rich nations. Americans die at higher rates than people in other high-income countries. Our lives are shorter than theirs. America may lead the world in science and technology, but other countries have made greater advances in keeping their people healthy. And isn't our health supposed to be the purpose for which the entire healthcare industry exists? I chaired an expert panel that released a report earlier this year. The panel was convened by the National Research Council and the Institute of Medicine, funded by the National Institutes of Health, NIH. We compared the United States with 16 other high-income countries, and the title of our report says it all: Shorter Lives, Poorer Health. Americans rank last in life expectancy. We die earlier, and we have higher rates of disease and injury. This problem cuts across the whole population. There is a U.S. health disadvantage for American men and women, for young and old, and across multiple areas of our health, from infant mortality to traffic fatalities, from teen pregnancies to diseases of the heart and lungs, diabetes, and disability. The U.S. health disadvantage threatens our children. American children are less likely to reach age 5 than children in other rich nations. Our babies are less likely to reach age 1. Our rate for premature babies is similar to sub-Saharan Africa. Our teenagers die at higher rates than teens elsewhere, and they are sicker. U.S. teens have the highest rate of teen pregnancies among high-income countries and the highest rate of STDs. The U.S. has the highest incidence of AIDS, 9 times the international average. And we shouldn't think this is all about the poor and minorities. Their health is certainly worse, but the U.S. health disadvantage affects us all: white Americans, rich and poor, people with college educations. Our research found that Americans of all social classes are sicker and dying earlier than their counterparts in other countries. Why is American progress in health failing behind other countries? The reasons are complex, but flaws in our healthcare system are a key piece. All the countries with better health outcomes offer universal health insurance. Compared with people in these countries, Americans in survey after survey are more likely to find care inaccessible or too expensive. Lapses in the quality and safety of care outside the hospital are more common in the United States. The Affordable Care Act lays out a comprehensive strategy to tackle these long-standing problems. Is there more that can be done? Certainly. Besides health insurance reform, we must transform our communities to promote healthier lifestyles, stimulate economic opportunity for the middle class, and do a better job of educating our youth. These actions can do far more than medicine to prevent disease. But a basic requirement is a healthcare system that, number 1, works well, and number 2, is available to everyone. We've failed on both counts under our old model, and we now have a chance to build a solid foundation. Critics say that health reform is too unpopular and too costly. Some prefer the status quo. It's important to remember that the status quo puts our lives at stake. Under the status quo, the U.S. health disadvantage has been worsening for decades, but as Senator King said, I don't think the human toll has been made tangible to the public. Here's an example. I don't think American women know that their health is declining. This map shows that in 43% of U.S. counties, death rates among American women have been increasing since the 1990s. American women are less likely to reach age 50 than women in other high-income countries. The red dots on this chart show life expectancy for the United States. The gray dots show life expectancy for other high-income countries, and it's showing the probability of a woman reaching age 50. As you can see, the U.S. women have completely fallen off the chart in terms of their probability of reaching age 50. And this trend has been going on since 1980. And if this loss of life isn't compelling enough, remember that the U.S. health disadvantage means soldiers are less fit for duty to protect national security, and American workers are sicker and less productive, making our businesses less competitive in a global economy. Measured in lives or dollars, the problem with our health system are simply too costly to ignore. Change is difficult, and change always makes people uneasy, but in this case, we will pay with our lives, and so will our children if we don't make a change. No political agenda seems worthy of that sacrifice. Thank you.
Thank you very much, Dr. Woolf. Dr. Candace Chen is an assistant research professor in the School of Public Health at George Washington University and a practicing pediatrician. We thank you very much, Dr. Chen, for being with us.
Well, thank you for giving me this opportunity to talk about how critically important the Affordable Care Act is. I am a primary care pediatrician, and I see patients in Southeast DC. My clinic is about 5 miles from here, and it's in a part of DC that most people don't ever go to. And I take care of patients like Diamante Driver. As Senator Cardin mentioned, Diamante was a 12-year-old boy who lived in PG County, just over the border of DC. And he died of a tooth abscess. The bacteria from that tooth abscess spread to his brain and killed him. But a tooth abscess is not only completely treatable, it is completely preventable. One of the things that the senator didn't mention is the week before he was admitted to the hospital, he had an appointment to see an oral surgeon. The family had to cancel that appointment because they had lost his health insurance. And so it is an example of how, another example of how insurance is just so critically important in terms of health and preventing death. At our clinic, we're pretty lucky. Most of our patients do have health insurance, usually under Medicaid. And that means that they can get preventative services. They can get the immunizations, the screening tests. They can come in when they're sick. They can go get their medications, and they can see a specialist when they need to. But we also see uninsured patients, and I've learned to always look for insurance status. What I've noticed is that over and over again, the first time they come to us is typically after being in the emergency room or being in the hospital for something that was completely preventable, like an asthma attack or a tooth abscess. And I think, if you had just come to me earlier, we could have started you on medications to control your asthma. I could have given you a flu shot. I could have treated your asthma attack before it got so bad that you had to go to the emergency room and be hospitalized. And we know that those hospitalizations, they mean missed school days, they mean missed work days, and they are extremely expensive to our system. And those costs are a burden for the families, and they're a burden for our health system. But they didn't come because they didn't have health insurance. The other thing I've learned with our families is to always ask whether they can afford the treatments that I'm prescribing. And I find that this is particularly true with the families that don't have health insurance because those are the families that are our working families. And the reason that they work is to provide for their families, to provide for their children. But when I ask them that question, I watch them because I can see them thinking, how much money do I have in my purse today? When is the rent due? How much food do I have in my refrigerator? And when is the next paycheck coming? No parent should have to choose between health care for their child and the next meal or paying the rent. I think it's already been mentioned, the studies clearly show that not having health insurance affects health outcomes. Anywhere up to 45,000 additional deaths occur every year because people don't have insurance. And the evidence also clearly shows that people who don't have insurance are less likely to get preventive care. They're more likely to delay treatment. And the end result is sicker patients with poorer outcomes when they can't put the treatment off any longer. But as alarming as most of these studies are, I also find hope. In a 2012 New England Journal of Medicine study by Ben Summers, they showed that Medicaid expansions saved lives, up to 19.6 lives per 100,000 adults. What that shows is that health insurance matters, that health insurance saves lives, and that the Affordable Care Act can save lives and will save lives. Thank you.
Dr. Chen, what you're saying is so obvious. I mean, it's that if we give people health insurance, they go to the doctor, they're going to stay healthier and not die, right? Let me ask you this. I'm jump in here, and then we're going to get to Mr. Potter in a second, then we'll have a little bit of a conversation here. In talking to physicians in Vermont who work in working class areas, they have found that sometimes, one doctor was telling me perhaps 25% of the time they write prescriptions, but people can't afford to fill those prescriptions. Is that something that you experience or have seen experience?
Yeah, absolutely. And what I find is that when I ask, most people will say yes, because how do you look at your doctor and say, no, I'm not going to fill that prescription? But when they walk out the door and they think about, I have to buy groceries for dinner tonight, I have to pay the rent, my paycheck's not coming, I can't fill it right now. And then what happens is hopefully they'll come back to me when they have the asthma attack, when the infection is getting worse and we can help them deal with it. But worst case scenarios are they end up in the emergency room, they end up in the hospital.
Could I just make a comment? Senator Sanders, you're absolutely right. Dr. Woolf's numbers about the numbers in this country compared to the industrial world is somewhat shocking. But if you look at certain categories, those who have no health insurance, those who are poor, minority communities, and I understand it's bad in all, the numbers are much more shocking. So let me just leave you with this one statistic that just came out. There was a study done in Baltimore, where I live, this past year. And the life expectancy, depending on what zip code you live in, varies by as much as 30 years, just by where you live. And that is access to care, whether you can get a doctor, or even if you might have Medicaid coverage, if you can't get access to care, your life expectancy is, you're going to be in emergency rooms rather than getting the preventive care that you need. So the point that we're raising here with the Affordable Care Act, it is the blueprint for really changing the landscape in America. It's got to be implemented, it's got to be modified, but to defund Obamacare would just turn this nation back on the progress we are making when we have such a long way to go. So I just want to thank the entire panel, and I apologize to Mr. Potter because I'm not going to be able to stay for your presentation, and I look forward to continue to work with our real champion here.
Well, let me just tell Senator Cardin that the issue that he raised about disparity in life expectancy, even within one city, we're going to do a hearing on that issue because I think, as many of the panelists have indicated, these are issues that do not get the discussion they need. One thing that we do know is that if you live in parts of Kentucky, as opposed to Marin County, California, there is a 20-year gap in the United States of America. That is, in one area, you're in Bangladesh life expectancy, in another area, you're at where the rest of the world is.
No, and the Affordable Care Act also, as you know, elevated the capacity to deal with health disparities. We now have a National Institute for Minority Health and Health Disparities, and we need to focus on how we can reduce the disparities in this country. It is shocking that you can live across the town from just where you live affects how long you're going to live in this country.
Thank you. And Senator Cardin, thanks so much for being here and for the work that you are doing, and we're going to continue this effort. We're delighted to have Wendell Potter with us. Mr. Potter, thank you for your years of raising issues about the pharmaceutical industry and other areas. We appreciate your being here and look forward to your testimony.
Thank you very much, Senator. I really appreciate the opportunity to be here. Chances are I wouldn't be here had it not been for a decision I made when I was still working for Cigna, for a health insurance company, back in 2007, to go back to Southern Appalachia, where I grew up, just to visit relatives. I, at the time, had been given the assignment of writing a paper on the problem of the uninsured, but from the insurance industry's perspective. And the whole idea was to write a paper that would try to make people think that it wasn't such a big deal after all, that if you slice and dice the data in certain ways, you could make the point that a lot of people are that way by choice, and a lot of people who have relatively high incomes are uninsured and have just made a decision not to buy coverage. I was getting pretty frustrated with that assignment because I knew that wasn't necessarily the case, and I also knew that the policies and practices of the industry that I worked for had really exacerbated the problem, had made it necessary for a lot of people to go uninsured because of the practices of insurance companies for many years to blackball people because of pre-existing conditions, or to price policies beyond their means to pay if they've been sick in the past. I went home to East Tennessee, where I grew up, and while I was there, I read an article about something called a healthcare expedition that was being held a few miles up the road, actually in Southwest Virginia, not too far from the Kentucky state line. The newspaper article said that people would be driving actually from as far away as Wisconsin and Florida to come to this event. that was being held at the Wise County Fairgrounds. I went there out of curiosity, primarily because of this paper I was having to write. And I'd never heard of this organization that was putting this on. It was Remote Area Medical, an organization that got its start in 1985 to fly doctors from the U.S. to remote villages in the Amazon. Pretty soon after they started operations, they started getting calls from this country. The first one came from Hancock County, Tennessee, asking if they would be willing to do an expedition in that county. So they agreed to do that, and since then, most of their expeditions are not in third world countries, but they're in this country. And not just in places like Wise County, Virginia, but in Chicago and Los Angeles, all over the country. And every time that they have an expedition, they have to turn people away. There are never enough volunteer doctors or dentists in particular. I found out that a majority of people who come to these expeditions are there because of the need for dental care as well as medical care. When I got there, I saw something I never would have expected to see in this country. People that I could have grown up with, Senator, who were lined up in long, long lines waiting to get care that was being provided by these doctors and nurses and other caregivers in barns and animal stalls. And these folks were standing in long lines in the rain. It was a day like this, and they were soaking wet, but they had no other options. And these were not the poorest among us. They were people who were working folks. They were not enrolled in Medicaid programs, and they were not on Medicare either. They were people who were just victims of circumstances, and in many cases, circumstances created by the industry I used to work for. And I realized that very day that what I was doing for a living was in some way making it necessary for folks like that, people like me, who could have been people like me, to resort to getting care in barns and animal stalls. So I made a commitment that I would try to figure out some way else to earn a living. And I ultimately did. And I decided eventually to begin speaking out about just how dysfunctional our healthcare system had become and how people were having to resort to such circumstances to get care that they needed because they just simply in many cases couldn't afford it, but in other cases because they couldn't get it at any price. And that's one of the things that's so important about the Affordable Care Act, is that starting on January the 1st, some of the most egregious practices of the insurance industry will become a thing of the past. Some of the reasons why those people that I saw having to stand in those long lines, some of those reasons will fortunately go away. Soon after or about the time that I gave my first Senate testimony, it was in 2009, the article appeared by Harvard researchers showing that as many as 45,000 Americans die every year because they don't have health insurance. And I know that probably is a very accurate number, because I have met people who have lost loved ones because they could not get coverage. I've met mothers who've lost sons who've died, and I have met many people who have I've lost loved ones. So the Affordable Care Act is making a difference. It already has brought many people into coverage, and starting next year, it'll bring many more into coverage, and we simply cannot afford to see this law gutted or defunded. Thank you, Senator.
Well, thank you very much, not only for your testimony today, but from having come within the industry itself, the insurance industry, telling the American people what goes on within that industry, and your work has been invaluable. Let me just start off by asking a question to anyone who wants to jump in. Today, I think we were focusing on the moral issue of withdrawing insurance, so not providing insurance to millions of people, some of whom will die because of the lack of insurance. Others will become sicker than they should have been. I want to just throw out another question to you and talk about economics. At the end of the day, and I think a number of the panelists have raised this issue, despite the fact that we have 48 million people without any health insurance, we end up spending almost twice as much per person on health care, right? Now, somebody can make an argument, well, we're not a wealthy country, we just don't have enough money, we have to cut back, and it's unfortunate. But that's not the case. Now, how does it happen? Somebody explain to me, and maybe related to what we're talking about today in primary health care, how does it happen that we spend almost twice as much per person on health care as any other major country on earth, and yet have poorer health care outcomes. Mr. Pollack?
I want to pick up one facet of your question. Obviously, we would have to have a significant discussion about what are the drivers of healthcare costs in the country, but I want to tie your question to what the overall panel has been discussing, and that is, what is the economic impact of people being uninsured? And I'm not talking about absenteeism in the job and so on, but for those people who have health insurance, it actually has an economic impact, and that's because when people are uninsured and they go to an emergency room, often they can't pay for the entire bill. We did an analysis a couple of years ago that took a look at what happens with respect to the bills of those people who are uninsured who receive care. And the way it is paid is in three different sources. One part, 37%, about a third, paid actually by the uninsured themselves. They pay out of pocket. Third-party payment.
By the way, they pay a pretty heavy price for that emergency care.
They pay more than what others pay because they don't have the benefit of bargaining with an insurance company that you can do through a third payer. About 26% of the costs are picked up by government programs and charities. The remaining portion is actually paid by everyone who's insured, because we all get a hidden surcharge, so that I'm not criticizing hospitals, but hospitals, especially in low-income areas and areas where
Cost shifting is what you like.
they'll go out of business.
Yeah.
And so they pass on the cost to all of us. And so what we try to assess is how much of our insurance premiums are devoted to paying for the costs of the uninsured. And this is from a few years ago, so the numbers would be higher today. The hidden health tax, as we called it, for family health coverage was approximately $1,017. For an individual, it's $368. That doesn't answer completely your question. And one of the things, by the way, that came to mind as I was listening to the testimony, it reminds me of a story of a friend of ours, and this occurred just 3 weeks ago. A young woman who's 18 years of age. She's uninsured. She lives in a family of 5. Her mom runs a little daycare operation out of their home. Her dad periodically does construction jobs when they are available. Her 2 brothers work part-time in retail stores. So it's a relatively low-income, but a hard-working family. This young woman, 18 years of age, who's going to school, went to the doctor with her mom because she's had significant vaginal bleeding recently, and she has significant lower back pains. And when she went to the doctor, her mom said, when was asked, "Where's your insurance card?" She said, "We're not insured, but I have brought cash." And the doctor said, "I am not going to treat your daughter. I'm not going to take the cash. I only cover people who have health insurance."
Let me narrow my discussion, and that's just an extraordinary situation. God knows how many times a day that takes place in America. But let me ask you this. I talked to the medical director of a very large American, in fact, multinational corporation. And this guy said that he thought, and they were moving in this direction, that by providing free primary care to all of their employees, they would actually save money. In other words, they wanted their employees to go to the doctor when they were sick because they thought that was cost effective for the company. Comments on that? Does that make sense? Mr. Rome, Dr. Woolf?
It makes sense because when people are healthier, it costs less to treat them because they have less to treat. And the issue of preventive care is the most clear, proven issue. When people get care, they have less disease, they have less things to treat, they're less likely to go to hospitals, the most costly place for the provision of care. And so that's why that has to be addressed. And I just want to say a very quick thing about your other question about costs, as a way of just giving an example. We spend twice as much as the next country on our pharmaceuticals, on our drugs. That does not help with our costs, right? And there's absolutely no reason for it. And so that's just one example of a way to so-called bend the cost curve in a way that will not have a negative impact on the system and on patients.
Okay, what I'd like to do now, I'm going to ask Dr. Woolf to comment, and then we want to go to our last guest, and that's Anelia Russo. I want her to say a few words. Dr. Woolf?
Senator, the question you raised earlier about why we spend so much in this country was something that our panel looked at, the National Research Council panel that I mentioned. And your point that was made is that critics often argue we don't have the money for this kind of service. But if you look across industrialized countries, there is no country that spends as much on health as the United States, both per capita and in aggregate. There's a study that was published by Elizabeth Bradley and her colleagues at Yale University that received the attention of our panel, where she looked at all the industrialized countries, including the United States, in terms of how we spend that health money, in terms of the ratio between health care spending and social spending. And you'll see that all the countries that have the much better health outcomes than the United States are spending more on social spending per capita than we do in the United States. And there's a logic behind that. A statistic I often like to quote has to do with diabetes mortality. Diabetes is a major cost driver in the United States. The difference in mortality for middle-aged adults with diabetes who have not graduated from high school is 3 times the mortality rate for adults who have had at least some college education, so triple the death rate. So if you're looking at how do I reduce costs?
Does that have to do with lifestyle, would you guess?
Well, it's complicated. It has to do partly with that, but it also has to do with the fact that people who have an education get better jobs, have health insurance coverage, have better economic resources to purchase a healthy lifestyle. But the point is that they've done the math and figured out that those investments are going to actually save you money. And then in the healthcare sector, they have invested their resources in a more efficient care delivery model than we have in the United States. And the Affordable Care Act's investment, for example, in clinical preventive services to remove co-payments and eliminate financial barriers is based on an inherent logic that we are going to accomplish more, purchase more health per dollar through early detection of diseases and treatment, as Senator King eloquently described, but also through a heavier investment in primary care, building that platform, community health centers, and so forth, that enable us to more effectively tackle the chronic disease burden than waiting for end-stage.
I mean, that's just an extraordinary statistic about diabetes, which is what's costing us many hundreds of billions of dollars a year right now. All right, I want to hear from Anelia Russo, and we thank her very much for being here. She is a healthcare advocate, and she is also a heart surgery survivor from Maryland. Ms. Russo, thanks so much for being here.
Thank you for having me. I just want to touch on my own situation and what I've been through this past 4 years.
And hold that mic a little bit closer to your mouth, please.
I just want to touch on what I've been through, my own personal health experience. 2009, I was feeling some sort of uncomfortness in my chest. I had no insurance, went to the emergency room and got sent home. I was having anxiety. Long story short, 2012, symptoms are still there. I ended up having a heart attack at a Go Red event for the American Heart Association in Towson. And a couple of days later, I didn't know I was having a heart attack. It was the symptoms. I then had insurance in 2012. Luckily, I did have some insurance. And I went to my doctor. She admitted me right then and there, rushed to Johns Hopkins, had double bypass open heart surgery. I was told that if I did not have the surgery, I wouldn't survive. My my fear with this whole thing is that now I wasn't able to work for a couple years due to my health conditions. 1 month ago, I had aortic bypass, another bypass, because my condition is so severe that my liver produces toxic amounts of cholesterol, which I can't take statins because I'm allergic, so I'm seeing specialists that are helping me with that. Now, my fear here is now that I've had this surgery, I'm feeling better, I'm up and about, and I just went back to work, and I'm realizing that I'm gonna have to go out in the marketplace and find another insurance. I'm currently covered under Medicaid because I wasn't working, but now I'm back to work as a realtor, so I'm scared. I'm afraid of what's gonna happen because I do have a terminal illness here that is hard to fix because of a certain gene that I have, and I'm afraid that I'm not going to see the same doctors. I'm afraid that the people that have been treating me for these past years under one insurance are scattering. If this doesn't go through, what our insurance company is going to do to me? They're going to deny me, and I'm going to be left to die, and that is my fear.
Well, thank you very much. What you have gone through and are going through takes place all over this country, as you know, many, many thousands of people. And not everybody comes to a hearing in Washington, D.C., and we very much appreciate speaking out, not just for yourself. In your testimony, you are touching on every issue that we have raised today, and that is the right of people to get the health care they need when they need it, with the doctors that they want to have. And that you are having to go through that. I mean, you have enough problems, health problems already, right?
Right.
You don't need the mental anxiety to worry about whether you're going to be able to see the doctor that you want. So thank you very much, Ms. Russo, for being, and thank you for your advocacy in general. You know, I want to get back maybe to the beginning of this discussion, picking up what Ms. Russo said, which is experienced by so many people. And by the way, Ms. Russo, you are aware that you have what's called a pre-existing condition.
Yes.
That 5 years ago, if you walked into an insurance company and gave them your health history, they would say, thanks for coming in, but we have no interest in insuring you because we lose money by taking you in.
They denied me in 2007 because I had severe high cholesterol.
And I wonder, and maybe panelists can help me, if in other countries around the world they could even comprehend the absurdity of something like a pre-existing condition. The function of insurance is to provide care to you. To say that we can't treat Ms. Russo or somebody else because they are ill, I suspect in other countries they wouldn't even know what you were talking about. I mean, am I right on that, or anyone, Mr. Potter?
Senator, you're exactly right. It's just unknown. And what happened in this country, and in fact, the original concept of insurance in this country began in a much more benign way. The insurance was provided on a community rated basis, and then large corporations decided they could make money by segmenting the population and just targeting only the healthy and the young. And that's what has developed over the years, and it's gotten to the point that there are dozens of conditions in which insurance companies will not even look at you. They will never offer you a
I mean,
policy.
the insanity. I mean, the function of insurance is to provide the help that a person needs. To say that we can't insure you because we can't make enough money out of you, but we can insure you because you're young and healthy. I mean, that is just so absurd. Ms. Russo, did you want to?
If I had been treated in 2007 for the cholesterol, I probably wouldn't have had a double bypass and aortic bypass these past 2 years.
Okay. Yeah, Mr. Pollack.
You know, we have released in the last year state-by-state numbers of the people who have pre-existing health conditions. It's more than 1 out of 3 people in the United States have pre-existing health conditions. Now, they're not all uninsured. Most people who have pre-existing health conditions are in jobs that have health coverage, and they have not been denied coverage due to a pre-existing condition. But folks who are in that position can't take a whole lot of comfort, because what happens if they decide to change jobs? What happens if they want to start a new company? What happens if they are laid off? And so there are lots of people who are uninsured because they have a pre-existing condition.
I mean, the bottom line is that if this hearing is an effort to talk about what happens if the Affordable Care Act is repealed. This is what has gone on until a few years ago. Dr. Woolf, I think did you want to say something?
I was just going to share an anecdote. A colleague of mine from Columbia University was on a trip in Europe and became sick and visited an emergency room. They treated him very well, and at the end, he reached for his wallet to pay, to show that he had an insurance card, and they said, "You're not in America, put your wallet away."
This has been a wonderful hearing, and what we are going to do, we're going to, and as I mentioned at the beginning, this is a non-hearing hearing, if you like, because we needed 2 weeks to give notice to make a formal hearing. The next formal hearing that we will have will be dealing with some of the issues that some of you have discussed, Dr. Woolf and others, and that is how it happens that in this great country, we have people in some parts of America or some communities in America dying 20 years earlier than other people. How does that happen? But the issue that we are talking about today is that repealing the Affordable Care Act will be a death sentence, no question, for many, many thousands of people. That movement toward increasing insurance and primary care access will not only save lives, but save money. My concern as a single-payer advocate is that the Affordable Care Act is providing, we think about, and this is because of some Republican governors not welcoming Medicaid expansion, about 20 million, I think, more people will have access to health insurance in a country where we have 48 million uninsured. So we still have a long way to go. We need other structural changes in the healthcare system. But this is an issue that is, the issues that we're talking about today, about people dying unnecessarily, about spending huge sums of money that do not have to be spent, about making it impossible for some people to get health care, health insurance when they desperately need it, as Ms. Russo was talking about. These are the issues we need to pound away at. And hopefully, at the end of the day, the United States will join the rest of the industrialized world, where health care will become a right for all people, where Ms. Russo and millions of other people will not have to think twice about going to the doctor when they need to go to the doctor. We will be a healthier society, and we'll have a much more cost-effective healthcare system. So I want to thank all of you for the work that you do every single day. We're going to continue the fight, and at the end of the day, we're going to win this. So I want to thank all of you for being with us today. Thank you. Hearing is closed.